Hello everyone, this is Dr. Casen and Dr. Bob DeMaria coming to you from the Drugless Doctors and Drugless Doctor, and we are talking about heart health, Dr. Bob, and February
is Heart Month.
Heart Month, and it's all about supporting your heart, and your heart not only is really important for what you think of beating and the blood flow, but there's a lot of other factors that go into our hearts, Dr. Bob.
You know, I don't think that sometimes people realize how significant the heart is. You know, it beats normally about 72 beats per minute. If you do the math on that over time, that's a lot. If you're living 70, 80, 90, or 100 plus years, this heart, which is a pump, continues day and night, and you cannot go very long without this heart beating and moving fluids through the body. It's a very, very important part of your long-term health, taking care of that heart.
And some people from a young age too in our practice, they could be experiencing heart palpitations, dizziness, all different types of things. And what's interesting is I had a gentleman in this past day, and his job, Dr. Bob, is he goes in during surgeries when people are doing heart surgery to troubleshoot the equipment that they're using as they're opening the valves and doing all these heart procedures. So I know that
that's stress.
If you are experiencing some of these body signals, or maybe you've had a heart procedure yourself, you really want to listen closely, because you really want to work on developing a strategy to keep your optimal health, but not only your heart, but other things going on. So what do we do in our office, Dr. Bob, in regards to with the heart? There's all these different tests, and this is not a traditional evaluation that you have ever done also, because people come in with all types of tests, Dr. Bob.
Well, this happens to be the graph of a heart sound recorder. And Dr. Casen, the heart, as most of you watching us right now would know, goes lub-dub. You don't think about the fact that there has to be nutrients and muscles contracting for those valves to open and close. So the heart sound recorder is an electronic stethoscope that's attached to a computer, and it digitally assesses sounds. We have a very sensitive stethoscope. It's an electronic stethoscope. And we put the recorder or the stethoscope over 4 areas on your chest wall, over in front of just where your heart would be located. And we look at the sounds. So for example, when you look at this particular sound right here, it seems to be very wide. Well, I know historically, and from a nutritional point of view, that person could use some B vitamins, because the B vitamins helps the snap, helps the tone. And taking that a side way is that when you consume sugar, it takes B vitamins out of the body. So we might have conversation with somebody and ask them about what they're eating, but do you cry easy? Do mosquitoes like you? Do you have sore muscles after exercise? Do you hear humming in your ears? Those could be an example of B vitamin deficiency issues that'll show up on the heart. You know, the heart is so sensitive. Nitroglycerin is what they've used to open up the blood vessels in a person's heart. You put that nitroglycerin in your mouth, within milliseconds, Dr. Casen, those blood vessels open. And you know, many years ago when I first started using the heart sound recorder, I had this young man that came into the office, and it was like all over the place. It was an obstacle course. So I just had this intuitive thought to ask him if he had French fries for lunch. And he did. And you might be saying, Dr. Bob, French fries can impact the heart. Anything that you put in and on your body can impact heart function. So the heart sound recorder has been a very important tool for the evaluation of hearts in our practice.
And it's amazing, as you were just talking about the B vitamin need, I just had a woman today, and she's having heart palpitations, Dr. Bob, and she actually was doing her food prep this weekend. She said, my shoulder's so sore, and it's been sore for 2 weeks, and I did this 2 weeks ago with cutting some of these vegetables up, and she has fair skin, she has red hair. I know with, also we talk about B vitamins and other minerals, and I said, do you cry easily? And she had a little tear in her eye. I said, you need B vitamins when it comes to those body signals with her heart function. So I know also, Dr. Bob, another question we had is, why is vitamin D important for heart health? And I know we have 2 different products here. We have the capsule vitamin D and also the liquid vitamin D that we use in our office.
Well, I can tell you, here's why vitamin D is so important. First, we're in Northern Ohio right now. And when you're in northern Ohio during the wintertime, if you're above the Mason-Dixon line, the way that the sun angle comes down, even if you're outside, you have no suntan lotion on, the sun is not going to convert, this is really significant, the cholesterol in your skin to vitamin D. So what is vitamin D? Vitamin D helps take calcium out of the intestine and it puts it in your blood. Now vitamin F, which is essential fatty acid oils, takes the calcium to the periphery and to the tissues in your body. But calcium itself, Dr. Casen, there are people who have high blood pressure because they don't have enough calcium. It relaxes the smooth muscles in their body. So vitamin D is an integral part of calcium absorption. So we have both products, the D and K caps that balance each other out. And we have this D-emulsion. And I'm going to tell you, I use this D-emulsion. It makes a huge difference. When we have people that have their vitamin D tested, those that are taking the vitamin D emulsion always have normal vitamin D. And it can do a lot. It can help lower your blood pressure. It does a lot to help overall health in your body.
And I know someone's going to ask the question, how much do you take, Dr. Bob?
I wash my face, brush my teeth, and put 2 drops in my tongue every day.
And the capsule, the DK, you take 1 capsule once a day. So really easy to incorporate.
Yep.
And I know also when it comes to heart health, Dr. Bob, additional resources for everyone. You wrote a book on how to prevent surgery, and there is a whole heart chapter in this book. Whether you've had surgery or you want to prevent surgery, this is really a great resource.
It's a tremendous tool. It'll make a huge difference in your overall long-term heart health strategy.
Yes, and also last thing, you have classes online, and I know that you have a specific one that is specific for heart health. So if you're watching us, classes.druglessdoctor.com, I know you will be glad you did.
Thank you.